Hello, everyone. My name is Magali Castro, and today I am. Today, my quality improvement program is in improving the flow by optimizing the utilizations of beds related to discharge planning. So, issue identification. The emergency department in Martin Luther King Community Hospital faces multiple challenges towards providing a high quality and timely manner. The lack of bed utilization related to discharge planning of the emergency department is a significant concern at Martin Luther King Community Hospital, affecting the unit flow, patient outcome, and the delivery of high quality of care. Research on improving flow-related discharge planning. One research states that improving patient flow within the emergency department is ultimately achieved by reducing the amount of time patients spend in the emergency department, thereby it reduces departmental crowding. Another research phase with inherent inefficiencies built into transfer of a patient from emergency department to an inpatient bed. We determined that the timely availability of an inpatient bed was essential to improve efficiency and flow. Lastly, the last research that I'm providing is the discharge delays and increased demand contribute to flow, health, and social care system that have adopted best practice to improve flow, find themselves much better able to cope with external pressures than those that have not. Quality variance. So according to the Joint Commission, the patient flow standard and the 4-hour recommendation is considered the gold standard. Joint Commission developed this standard in about 2005, but was not implemented into the hospitals until 2014. This standard focuses on the collection and utilization data to improve the management of patient flow. It also helps the standard data provides objectively in determine the cost of patient and or issues in the organization, and in assessing the success after the implementing of strategies. So another way that this standard is used is begin with the baseline measurements to set goals of the program. It identifies the metrics to be collected across all patients' areas that played a role in patient, including testing, diagnostic, and procedural areas, as well as support services. So what is the root cause of analysis? It is challenging to identify the primary cause, considering that there are a multifactorial causes with the discharge planning. Lack of admission policy will be one, lack of adequately scheduling elective surgeries, properly triaging patients, frequent technical errors, delayed in laboratory image testing. This is actually a huge one in delaying laboratory testing. Delayed of consultants. It also, in limited number of staff will be a root of cost. So the scope of the problem. So lack of better utilization is an ongoing concern for many emergency departments throughout the nation, including Martin Luther King Community Hospital. Unfortunately, multiple quality aspects that can be analyzed consequently to judge on what is correct cause of the problem, nevertheless, is a multifactorial. There are many stakeholders that are at risk and can potentially become a problem for the organization. For instance, hospitals are the ones that create the policies. Nurses and nurse managers are the primary stakeholders in improving bed utilization related to discharge planning. For instance, during triage, nurses do not adequately prioritize patients' treatments based on their severity. Nurse managers are not able to follow and properly track patients. Physicians are not properly writing discharge orders. Also, admission representatives are not focusing on improving the registration process in preparing properly and detailed records. Patients and family, they usually are related to the scope of practice because they don't understand or they're not aware that there's also urgent care instead of emergency department, or better yet, a primary doctor to resolve small issues. The solution. In attempt to improve patient care and maximize bed utilization, my leader and I developed 3 solutions. The first solution is improving the use of technology. This can benefit the hospital in optimizing bed utilization. Technology use in the emergency department can increase efficiency and patient satisfaction using devices and systems that can adequately track patients, facilitate common diagnostic tools. Finally, it can assist with effective communication. Some include self-registration kiosks in an interactive computer that is designed. This is like an interactive computer that is designed to include self-service task that includes check-in, viewing outstanding balances and collections of co-payments. It can also update patients' demographic, wayfinding assistant, and even ask patients fundamental questions. Real-time locating systems are another system that contains benefits, including patient flow, decreased treatment room turnovers, optimizes staffing. It can also improve patient satisfaction and improve families' communication. This real-time location system is a transmitter tagged for patients, staff beds, critical equipment, and administrators can access and accurate the location and can also now know the status of the patients. However, Martin Luther King Community Hospital is currently using mobile wireless registrations. This helps patients to be comfortable. The second solution will be creating a new position called patient placement coordinators. The patient place coordinators develop from a group of selected senior registers, nurses, and strong administration, that has a strong administration and clinical background. A patient placement coordinator uses diagnostic triage or other information in conjunction with medical staff to outline a plan of care that determines whether the patient will be assigned, matches this to a department or a nursing unit, and estimating a discharge date. Lastly, hiring nurse practitioners. According to a research says that nurse practitioner service demonstrates compatible effectiveness to that of the standard care model in the evaluation of the service indicator and patient report outcomes. So what is the solution implementation? Overall, most of the stakeholders were supportive, including my leader. The goal of the emergency department optimization is to improve the performance and quality measures while enhancing the overall patient experience, including technology use. The goal of Martin Luther King Community Hospital team is the use of incorporate real-time locating system by the beginning of 2019. Creating position for another implementation can be it was the creation of position of patient care coordinator in an immediate goal that the stakeholders are willing to incorporate. That's an immediate goal that they're willing to incorporate immediately as of November 2018. So stakeholders believe that this is a solution that can immediate change the optimizations of better utilization, considering that many nurses are qualified for this position. Hiring nurses practitioners for the emergency department will be incorporated until the end of 2019. So analyzing. Throughout the technology, equipment, and the assumptions of additional staff can be costly. The organization can be costly to the organization. It can generate patient safety, improve flow, and optimize desirable outcome. Accommodating and hiring staff can improve patient outcome and reduce costs in the long run, as well as patient satisfaction. Implementation of care coordination and nurses practitioners will assist with the optimizing bed utilization related to discharge planning. So overall, I really think these solutions that I provided can help this team to be able to, in the long run, to be able to have cost efficiency, low their cost. Also, it could, better yet, improving bed utilization. So what are the next steps? Focusing on the solutions based on the timely of Martin Luther King community hospital stakeholders are going to work closely with human resources to assist with promoting the patient's care, coordinating positions. Meanwhile, they would focus on hiring process immediately after. In the next step, stakeholders will create a meeting to revise the budget and determine the sequence of priority in which they can implement the hiring and technology solutions. If this solution does not take place, the emergency department will continue to face the challenge of lack bed utilization related to discharge. So that is all for my presentation. Thank you so much, and I hope you enjoyed it.